All right, can we go? Can we start? You want to behave so we can actually do this, Anton?
No, I usually like misbehaving.
We are not shaming people who get COVID, Anton.
Definitely not. We're just shaming Marco.
Are we ready?
Is This Going to Kill Me? A health podcast with Howard Feldman and Dr. Anton Meyberg.
South Africans are greatly impacted by load shedding. We know it disrupts every day of our lives. But what impact is it having on our health? Is load shedding going to kill us? A very good morning to you. I'm Howard Feldman. It is a Sunday, the 5th of, is it the 5th of March? 6th of March? 5th of March. Let's go with the 5th of March. It is Sunday, the 5th of March, and this is an episode of Is This Going to Kill Me? So a few weeks ago, I came up with this concept of LAD, load shedding anxiety disorder. What is that about? Well, that is when the lights are meant to go off, but they don't. So you want them to, but you don't really want them to. But we feel very unsafe when that happens. When they do go off, we keep worrying if they're ever going to come back again. The impact on our mental health, I believe, is enormous. Joining me in studio, as always, Dr. Anton Meyberg. Good morning.
Good morning.
How are you?
Good, thanks. And you?
You had a good run this morning.
Nice run, thank you.
How many kilometers?
A few.
You can show off. It's good.
Just a
it's
22.
Healthy. 22. Well done. How are you feeling?
Yeah, strong, thank God.
That's brilliant. And the weather's gorgeous as
Weather's
well.
great. It's a beautiful day. There's no load shedding outside during that time, so it's perfect.
Exactly. The sun doesn't load shed.
Yeah.
So
Not yet, but Eskom are trying to get hold of it.
As somebody said, it's not easy to steal the sun.
Yet.
But they're working on it. All right, let's talk about the impact of load shedding on our health. Give me your sense.
It's a big problem. From a medical point of view, we're seeing patients that are struggling and suffering, and it's causing extra admissions to hospital for the sole purpose that people who are on oxygen concentrators, when there's load shedding, people don't have inverters, they don't have backup systems, they don't get the required oxygen they need because the oxygen concentrators are joined up to a power supply. Therefore, they don't get oxygen, they become short of breath, they become anxious, they start coughing more, and they need to be admitted to hospital. A general thing like someone who's got sleep apnea, who uses a CPAP machine, which is continuous positive airway pressure machine, in order to keep the airways open so you can sleep better. If they don't have an inverter or anything to keep their power going, they could start suffocating while they've got the machine on in the middle of the night because there's no pressure being formed and there's a tight mask on their face that can affect them dramatically. Power surges take out all of these machines. And we're just seeing there's a major negligence from the Eskom government side towards people's health and towards people's actually functioning. And as you correctly said, LAD, load shedding anxiety disorder, which I absolutely love, which I think is a thing. You know, in psychiatry, there's terms called the DSM-4 classification of all the psychiatric conditions. I think this is going to be added to the psychiatric conditions.
Will I get credit for it?
Yes,
I should.
Yeah,
I made it up.
Yeah, 100%. I'm sure
I
you've
didn't make
patented
it up.
already.
I suffer from it.
Yeah, but I do think
early
it's a big issue. I mean, even myself, even if you've got some sort of backup system, even Friday night, I wasn't sure if the lights were going out or were they not going out. Did they go out? And if they did go out, did it affect us? And it's ludicrous. We all are suffering from this anxiety and this pressure that we're not in control of. And I think that's the thing, is there's no control. And when you're not in control, the anxiety levels go up, the psychological effects go up. And if we could just have one less issue like load shedding, I think there'd be a much better feeling of happiness and continuity in this country.
So, advice to people then that do have these CPAP machines and what is it, oxygen concentrators?
Look, it all boils down to, unfortunately, in the day, money. You need money to run these things. So you need to try and work out a way to try and finance an inverter. A pure inverter lasts for 4 hours, will keep your oxygen machine going, will keep your CPAP machine going, and they're not cheap, so it's an issue. So you've got to work out some way to finance it. But if you can do that, it takes away that strain and that pressure of not being able to breathe and not being able to use the machines properly.
Surely medical aids, I mean, maybe they do, I don't really know, but surely if they are seeing...
It's hard enough to even get oxygen for patients from medical aids.
Oh, is it? Okay.
So I don't know if they have done anything yet, but it would be excellent.
But if you think
medical
about
aids
it,
could subsidize it.
if people are landing up in hospital,
Right.
it's going to cost medical aids a lot more
So it's a numbers game. I think they've got to do
than
the
it
numbers.
would to that if somebody had an inverter.
If they see the numbers are going up and they see that it is a big issue,
might become
then it
something.
might be something that the Medicaid will supply, which would be a great idea.
Right. Okay. But in fact, they might already. Some people might already have been able to
do something.
Yeah.
Yeah.
So I don't want to say that they aren't. Obviously the impact on our mental health. What can we do about that in terms of load shedding? I mean, you go for a run.
Well, that's something. You got to exercise. You got to get out the house as much as you can. If you've got a chronic illness, it's very difficult. If you've got emphysema and you need oxygen, you can't exactly go for a run.
I hear that.
So
yes.
the most important thing is to
And the roads or the potholes, if you're running with your oxygen tank
gets
behind
bumpy.
you, does get bumpy. Yeah.
So the most important thing is, for lack of better
So I'm
words,
just trying to picture somebody.
is to breathe.
Yeah.
To breathe through it. You've got to actually just realize that.
Which is so interesting that.
Generally, we say that people with emphysema need oxygen 16 hours a day, minimum of 16 hours a day. So the majority of patients don't need it for 24 hours a day. So there can be a gap phase when they don't need the oxygen. But that being said, at 2 o'clock in the morning, when you don't have the oxygen and you start panicking and you can't breathe, there's nothing to substitute.
And
for
that's
that.
a cycle then, because
It's a cycle. Look, the other alternative is to get an oxygen canister from one of the companies, but those only last for 2 or 3 hours. Also, it becomes expensive filling them all the time.
Right. Okay. So it is very. Is that the main impact that we're seeing? The two aspects. One is
from
people's
electrical,
mental health, and the other is oxygen.
Well, it's oxygen, CPAP machines. Any electrical equipment necessary for your functioning in a medical purpose will suffer regarding this.
And that is a big issue.
Yeah.
Whilst we're on the subject, I wanted to just talk a little bit about people who are suffering from asthma. That's one of your main fields. It's one of your specialities. Has there been innovation? Has there been progress in terms of the treatment of asthma?
Definitely. So, I mean, over the
So
number
let's
of
talk
years,
about the
personally,
latest
I'm asthmatic,
developments.
and I was diagnosed with asthma at the age of 4 years old. If I look over the last number of years, the progress of the machines we use to determine if you're asthmatic, the medications used to treat, the relievers, the medications to control the inflammation. You've got to understand that asthma is a very burdensome disease and affects over 300 million people worldwide. It's an inflammatory disease of the lungs that can cause periodic and reversible obstruction of your airways. In other words, your airways close and you can't get air out, and it's difficult to get air in. And that could be due to an irritant, it could be due to pollution, it could be due to infection, it could be due to exercise, cold weather.
Exercise. So exercise is not good for asthmatics, is what you've just said. I thought I heard you say that.
Can we retract that? So generally, if you look at people who are asthmatic and exercise, like some of our swimmers, some of our soccer players, some of our runners, they're all asthmatic. And if you're on the right medication, if you're controlled on corticosteroids, because that's the mainstay of treatment, corticosteroids, which decrease the inflammation in airways and actually make the inflammation airways go from this to open up. So you need something that's called a bronchodilator, so that dilates your airways. The problem we're finding is that people rely on medications like Ventolin. Now, Ventolin is not an effective treatment for asthma. It's almost like taking...
I thought that's what we...
Yeah.
As a kid, that's what I used.
It's almost like taking Rennies for heartburn and hoping that it's going to get better. Okay, all it does is it treats the symptoms, but it doesn't treat the actual disease. So it's what we call a short-acting beta agonist. It doesn't help with treating the actual disease.
Wow.
The mainstay of treatment on all the guidelines is corticosteroids. There's different brands, and there's actually combination brands of what we call long-acting beta agonists, which are the longer-acting versions of the Ventolin, together with a corticosteroid.
Is corticosteroids always taken in a medication form, or can be in a spray as well?
So spray is also medication,
yes.
But there's different devices. There's inhalers, there's sprays, there's syrups, there's tablets. Now, we often get a lot of questions from people saying, but if I'm on cortisone, I'm going to put on weight, and I'm going to get glaucoma, and I'm going to get high blood pressure. The amount of cortisone that's in your inhalers is dramatically lower than in oral medications, and it goes directly into your lungs.
Where it's needed.
So it goes into the space where it's needed. Yes, it does disperse throughout the body, but there's a much less chance of you getting major side effects than taking chronic oral medication, which is corticosteroids.
Okay. Because I know that on a couple of occasions that I've been on cortisone, it made me a bit mad. I found myself to be just a little testy.
Yeah, so the problem with cortisone is it's probably the most fantastic innovation of our time because it treats so many things. It treats neurological disorders, it treats respiratory disorders, it treats allergies, that type of thing. But, with all good things, there has to be side effects, unfortunately. And side effects of high-dose cortisone is it can cause
your
euphoria.
family to be very irritable, irritating.
I always say take away the knives when someone's on high-dose cortisone so that they don't
I found my family
anybody.
really irritating.
But you would have to know where the kitchen is to take away the knives, right?
I've heard it's downstairs somewhere.
Right, so so it can cause anxiety, it can cause dysphoria, it can cause people to really have mood dips. Okay?
Insomnia?
It does cause problems with sleeping. And generally we say to people, take it in the morning. If you're on a short course of cortisone, let's say in a course for 7 days, it shouldn't cause much more than that. If you're in a course for 2 weeks or more, then you're going to see those side effects. And you just got to watch and speak to your practitioner about what to do about it.
But for asthmatics, often you can use it in a spray.
So for asthmatics, you generally don't need oral cortisone. We're talking about severe asthmatics that need other medications. We call things like immunoglobulin blockers, all different types of things, agonists that work in different ways that to help them. But in that stage, when you need oral cortisone, you're quite advanced with your asthma. I'd say that one of the biggest problems with asthma we're dealing with now is asthma is such a treatable disease. We shouldn't have people dying from asthma.
I was actually going to say, are people still dying today from
Unfortunately,
asthma?
they are, because
Really?
people aren't treated, because people think, once again, that the short-acting beta agonists like Ventolin are the treatment, and this is not the treatment. The other problem is that when you're on good medication for asthma, so when you're well controlled, when your inflammation levels are down, like any normal person, you think, well, I'm well, so I don't have to take my medication. The problem is that the inflammation is still continuing in your lungs. And what we find is that if you don't treat your asthma correctly, and if you don't treat it properly after a number of years, you can get what we call remodeling of your lungs, and it can turn into a COPD, which is chronic obstructive pulmonary disease, emphysema type picture.
Even if you haven't smoked?
So even if you haven't smoked, because of the damage of the inflammation in the lungs from the asthma, if you're not treating it, you can develop emphysema. Therefore, it is so important
I'm panicking right now.
to treat your asthma effectively.
And I actually feel I'm a bit short of breath.
Did you run this morning?
Is that asthma?
I actually think I'm going to have to speak to the medical aid and see how much I can charge you for this consultation.
I actually feel quite anxious. No, but I think I'm all right, right? I feel like I'm all right.
Do you want a medical opinion or do you want a psychiatric one?
Right.
I feel like I'm out of my depth there.
Okay, and I don't even have a spray. No, but so how does one check? I was asthmatic, or maybe can it be that somebody was asthmatic and isn't? I mean, I'm on no treatment. I used to be asthmatic. I used to be on treatment.
I feel like after this, you're going on to all the sprays.
I am. I definitely am. I'm going straight from here to discuss.
So the truth is that you can, what we call, grow out of asthma. Asthma becomes latent. We find that young children get exercise-induced asthma. Or
I've heard of latent homosexuality, not latent asthma.
Anyway, we get atopic asthma, which is an allergic type of asthma, and children can present with it. And when they get to the age of 18 to 21, they can generally outgrow it.
Okay.
Sometimes at a later stage in life, the asthma is no longer latent, and that could be due to stimuli, that could be due to inflammation. A lot of times I get elderly patients over the age of 70 saying, how can I have asthma? It's impossible. But people don't realize that the same way you can develop hypertension, which is high blood pressure or diabetes in the elderly age, you can develop any respiratory condition as well. So although you can grow out of it, and a lot of people do, it's still something that needs to be looked for and assessed. And what you've got to look for is if you've got wheezing, tightness in your chest, shortness of breath, and coughing for a long time, these are signs that there might be something going on there. And especially if you've been somebody who's been, let's say, on 3 courses of antibiotics in the last 3 weeks, something's not right. You've got to look a bit deeper, and you've got to speak to your practitioner and say, we need to look a bit deeper and say, is there not something else going on? If there's a family history, or are you living, the other thing, bring it back to generators, actually.
Really?
Generators from the diesel fumes and the petrol fumes.
Interesting.
These irritants cause irritation to your nasal passages, to your chest, and they can cause respiratory problems as well. They can cause a cough. They can cause postnasal drip, sinusitis. So that's another aspect of the load shedding related illness to this.
So interesting, because I was free of asthma until one trip to Hong Kong, and the pollution was so bad. They were warning people, elderly people, to stay indoors. There was some form of, and I didn't take much notice. I was there on business, and we walked to a meeting, and I actually found I was short of breath. I didn't know what was really what was wrong. And when I came back,
stimulant irritant, and that causes that.
I realized it was
causing
asthma.
inflammation in your airways and causing them to close up. They constrict.
Yeah. So if somebody has had a history, just make sure that when you do go for your checkup, that you
make your practitioner aware of it,
so that they can look into this, just to keep an eye.
And there's lots of fads with asthma. Those suction cups are not a treatment for asthma. There's plenty of people that go to certain people that put suction cups on their chest. And
yes, but they look cool. They look like they make you look like you're an athlete.
Yeah, the bruising afterwards doesn't look so cool, and it definitely doesn't help. Salt rooms don't help for asthma. Okay, there's a lot of things that are out there.
Does something like a sauna?
Ozone doesn't help.
Does a
asthma.
sauna help?
Sauna doesn't help for asthma. These things don't help your asthma. What does help asthma is regular exercise, especially swimming, because it controls your breathing.
Because it's a very breathing controlled process.
Yeah.
The other thing, in fact, that you put me on for my asthma, and that have had a significant impact, was reflux medication.
Yeah. So
why does that work?
A lot of people who have reflux. Now you got to understand what reflux is. It's called gastric esophageal reflux disease. What happens is you develop acid in your stomach, and when the acid levels get too high, the acid goes up towards your esophagus and spills over into your lungs. And that causes irritation in your lungs and can cause wheezing and coughing.
And you're breathing it in all the time, actually.
And that irritation and coughing is something that can be treated. And that's why we a lot of the time look for other causes of asthma. So if someone comes to you and they're short of breath and they're coughing and wheezing, you have a differential. And part of the differential is asthma, reflux, infection, pulmonary emboli. There's a whole lot of list of things we go through in order to discern what we're dealing with. But definitely people who have got reflux and we treat them for reflux, their asthma symptoms basically dissipate.
And that's something definitely people can be aware of.
Yeah.
I know that you are not over 50.
How can you tell?
But some of us are flirting with 50 at this stage of our lives.
So hold on. If you like 55 and less, do we round off to 50, or do we just say you?
First of all, I'm not yet 55. So let's cut that
but
right
you are
now.
very close this year, I'm saying.
Well.
So then do we round off to 60?
If I have to fill in a form.
But hold on, if you 54, okay?
Is that necessary?
No, I'm
Was
just
that necessary?
hypothetically stating.
I just said I'm flirting
and you're
with
in
50.
the womb for 9 months, so therefore you are over 55 actually.
Right.
So therefore
yes,
you have to narrow
I'm
down.
in my gestation for 55. Like, what the hell does that even mean?
So you're close to 60.
Either way.
Yes.
Either way. Let's talk about what happens to these incredibly mortal bodies of ours when we hit 50.
So I'll take it back a notch, because it's not when you hit 50, it's actually when you hit 40.
Really?
The year of your 40th year of your life is great. You hit 41 in one day, all of a sudden you get a pain in your shoulder, you get a pain in your back, you get a pain in the leg, and slowly but surely your body is not in sync with your brain.
Yeah, and it's getting ready for 50.
Yeah. So the biggest issue is when you get to the age of 50, things start not working as well as they should, okay? So your bones get weaker. If you're a female, your hormone levels start changing. It's the end of their menstrual cycles. They get hot flushes, night sweats, sleep issues.
Because
anxiety.
hormonally it's been such a breeze until this point.
Bone loss,
Yeah.
So the bones shrink, the bone density is decreased, their muscles
Men
lose
and
strength.
women.
Men and women, but more so women because of the estrogen levels. There's a whole, change in the milieu of the body. Okay, and they suffer from this. So as you get to 50, the key is not to think of 50 as an age, but to start thinking, how can I improve my lifestyle? This is the time when you hit 50, start exercising, be weight conscious. Know you've got genetic factors.
And it's much harder to lose weight then, isn't it?
Much harder to lose weight at age because your body doesn't adapt as well. When you're younger, it's very easy to lose weight. You develop certain eating cycles. You've got certain what we call circadian rhythms when you've got hormones released at certain times of the night, certain times of the day, and it's all related. And there's lots of fad diets out there. There are lots of things like, for instance, the keto diet, which I'm not a believer of. So the keto diet is actually a high-fat, low-carb, and adequate protein diet, which has actually been used since the 1920s in epilepsy patients to control seizures. And it might be very good for them, but it's a starvation diet. And you get a release of things called ketones. It mimics fasting, but it is not a good diet to be on. And why not? Because it increases your cholesterol levels, and it's pushes them very high, pushes up your triglycerides, your LDL, which is your low density lipoprotein, which is your bad cholesterol. You've got to be very aware of that and make sure that that's not one of your fad diets you stick on.
You like intermittent fasting?
Intermittent fasting works. For me, it works very nicely.
Works for me as well.
There's different ways of doing it. There's the 16-8 or there's the 18-6 rule, and that means you can either fast for 16 hours and then eat for 8 hours. And during that 16-hour period, you don't drink any processed things. You don't have milk. You don't have sugar. So you have basically black tea, black coffee, nothing to eat during that time. And then afterwards, you can eat or drink whatever you want for that 8-hour period. But if you combine that with exercise, any diet, you have to combine with exercise. Otherwise, you're not going to sustain it. And you've got to do a diet that's going to work for you, but at the same time, be something that you can actually maintain and take forward and use on a daily basis.
But is aging all about diet?
No. So aging is about moderation, as we always say, and changing your lifestyle. Not only diet, it's exercise. Exercise helps improve your bone density. It helps improve your circulation. It helps improve your brain function. It helps improve your respiratory function. That together with other things all add up. A lot of people take different types of vitamins. You've got to see if you've got a vitamin deficiency.
Should everybody over 50?
No. I don't believe that's the case unless necessary. Remember,
strict. I didn't
vitamins.
feel that was necessary.
Well, you better go and cancel that order.
Yeah.
Vitamins are only necessary if you've got a deficiency. You look at people who've got bone density issues, that type of thing. Calcium then plays a role. Vitamin D plays a role. But, to just get a vitamin infusion just for the sake of it is not necessary because you're just going to urinate it out most of the time. So in certain conditions, certain vitamins are required and needed, but vitamins not an answer to everything. If you're eating a moderate, well-balanced diet, you don't need those vitamins.
Right. I mean, in today's age, none of us are really in danger of getting scurvy.
Yeah. Okay.
I'm not. I'm fine. I've checked my teeth. No. But what about things like testosterone replacement?
Okay. So it's a bit of a button for me because you get a lot of younger people who, let's say, are gym fanatics and take testosterone to boost their levels. Okay. Remember that testosterone is not just a injection that you take without side effects. It can affect your prostate. It can affect all other things. It can cause excessive hair growth. It can cause anxiety. It can cause stress. It can cause rage. It can even cause you to lactate. Okay? It can cause a lot of issues.
Well, that's weird.
And if you don't need these medications, you shouldn't be taking them.
No, I guess my question is when we get to 50,
okay, so
our testosterone levels are meant to drop.
Yeah.
But why should we accept that? Because all they say to us is, well, your testosterone is normal for a 50-year-old. But why do we need to accept that? Why can't I have a normal testosterone for a 40-year-old?
No, so take it back.
No one's saying for an 18-year-old.
Look at men and women.
Yes.
Men have an issue with testosterone. Women have an issue with estrogen. Okay. Do we want to put every single woman on hormone replacement? The answer is no, because there are cardiovascular risks to it. There's clotting risks, and it's something that's got to be done very carefully and thought out very carefully between the gynecologists and the physicians and the cardiologists in order to decide if you're a candidate, if there's benefit versus risk. The same with testosterone. If your testosterone levels are flat and there's nothing there, then yes, you should take testosterone, but under guidance.
Right. Don't just go and...
but then you've also got to understand there are ramifications from doing it.
What are the risks?
As I said, there's cardiovascular
What do you mean
risks.
prostate? Like what aspect of it?
So it can cause large growth of the prostate. It can cause risks of prostate cancer. There's all other things that are involved here. And you've got to see that there's a bigger picture than just taking medication. Medication is not always the answer. You've got to deserve to be on the right medication. You can't just take medication willy-nilly, excuse the pun, and expect to just hope to get better without consequences. And if you do have, let's say you've got a very low sexual drive, you've got erectile dysfunction, and you don't have diabetes, you don't have high blood pressure, and there's no other reason why your levels are low, then you are probably a good candidate for testosterone.
Right.
But if there's other modifiable sort of diseases,
so it could be caused by
high
issues.
blood pressure, it could be caused by cholesterol issues, diabetes. All these things can be causes of
low sexual drive,
erectile dysfunction,
all of those
problems,
things.
And you've got to look into it very carefully.
Right. And the same with women on the estrogen side.
100%. There's nothing worse than when you get told by a patient that they're having these severe night sweats and they've got hot flushes and it's dramatic for them. They drench their pillows at night but you've got to weigh up the risks versus the.
Is there a natural way for men to increase testosterone and women?
There's a natural way for women to just there's
estrogen?
these soya phyto beans for the females, but they still have got estrogen containing type of things. So the natural isn't always a good answer.
Very, very, very interesting. Very, very interesting. So advice to people in terms of checkups as they're getting older. When should men start monitoring their prostate function? Not function.
To
their
generally
prostate.
say the age of 50. At the age of 50 is a good age to start
Right.
monitoring. And a general checkup, at the age of 50 onwards is very important. Even 45, depends on the lifestyle you lead. If you're leading a poor lifestyle, then 45. But 50 is a good sort of baseline to start checking your cholesterol, checking your thyroid, checking your kidneys, checking your liver, looking for all these type of things. And we're not saying go crazy and do a full body scan of every single organ in your life. I mean, it's just, that's out of, it's not in keeping with what you find, because sometimes you look too hard, you find things you don't want to find. But keep a balance and just understand that you're going for a checkup, you do your regular testing, you do your stress ECGs, all your bloods, that type of thing, and that keeps you knowing that you're in good nick or you're going in the right direction.
And I think what's important as well at a younger age, or any age in fact, is to make sure that somebody has a baseline for you.
Yep.
Because that's really one of
Very
the most
important.
critical things, that you have somebody to compare year on year to, whatever those levels, whatever that is.
Yeah.
I actually wanted to talk about genetics as well, but we are really running out of time. So I'm actually going to hold it over to the next time we talk, because I do want to speak about the role of genetics. Is our genetics a loaded gun? Is it inevitable that our predisposition towards something is going to be triggered at some point? These are the types of things that I'd like to discuss in some detail next time we get, hopefully next week, but next time we get together. If there are other questions, if there are other topics, we'd love to hear them from you, because this is a great format that when we get together, we can have these discussions around different medical topics. If you have questions on these specific topics, let us know. You can comment below in the comment section, and don't forget to subscribe, because that way you'll be alerted to a new release or a new video, a new podcast that we are going to release. So it's this is your time. This is your program. Whatever you want to talk about that's medical, let us know, and we will see if we can't make that a discussion. What's your advice for the week?
I think go out there, enjoy the weather while it's still
beautiful.
warm, exercise, eat well, be moderate, be happy, enjoy yourselves. Try and
exercise makes you happy.
That's it. It boosts your.
You're in a
hormones.
proper mood this morning, and then the end of it, look at you. You run 22 kilometers, and there we go.
There you go. It releases those hormones. Makes you happy.
You won't read. I have no idea what mood you were in this morning. I just made that up, but still, it's worth it.
So
just prove my point.
Just. You got to just understand that there's lots of things you can do. Let's ignore load shedding. Let's ignore corruption. Let's ignore gravy trains. And let's actually just try and actually
Put
just
it
take
aside.
it forward. If you're living in this country, you've got to actually just sometimes
Find
just
a way.
avoid
Compartmentalize
the
maybe.
negativity.
Absolutely right. I'm Howard Feldman, chatting to Dr. Anton Meyberg on episode 2 of Is This Going to Kill Me?
Is This Going to Kill Me? A health podcast with Howard Feldman and Dr. Anton Meyberg.